Cataract, a treatable eye disease. Introduction. Cataract is a common eye condition that causes clouding of the lens, leading to blurred vision. It primarily affects older adults, but can also occur due to genetics, injury, drugs, or medical conditions. Cataracts occur when the clear lens in the eye becomes cloudy, preventing light from passing through. Symptoms of cataract. The symptoms include blurry vision or cloudy vision, double vision, difficulty seeing at night, and sensitivity to light and faded colors. Risk factors of cataract. Risk factors include age, family history, diabetes, prolonged exposure to ultraviolet light, smoking, and eye injuries. Diagnosis of cataract. Diagnosis involves a comprehensive eye examination, including visual acuity test and slit lamp examination. Treatment option for cataract treatment involves surgical removal of the cloudy lens and replacement with an artificial lens. It means that surgery is the only effective treatment, where the cloudy lens is replaced with an artificial one. Prevention of cataract. Prevention includes wearing sunglasses, maintaining a healthy diet, and managing health conditions like diabetes. Cataract is a leading cause of vision impairment, but it is treatable with surgery. Early diagnosis and lifestyle modifications can help delay their progression. Essentially, early detection and treatment can restore clear vision and sustain quality of life.
Uncover the truth about cataracts. Watch our video to discover the causes, symptoms, and life-changing treatments that can restore your vision and brighten up your world in no time.